In older age, the kidneys become particularly vulnerable. These organs work non-stop, filtering blood and removing toxins from the body. But over time, their resources become depleted. As highlighted in the American Journal of Kidney Health, more than 40% of older adults develop chronic kidney disease, with many not even aware of it. Kidney diseases often progress silently. No pain, no obvious symptoms, while kidney cells slowly die off. Impaired kidney function leads to high blood pressure, anemia, heart problems, and even fatal body intoxication. The most alarming fact is that late-stage kidney disease is almost untreatable. That is why it is so important to learn how to protect your kidneys for as long as possible. Watch this video until the end. You will learn which habits and foods can help shield your kidneys from destruction. Subscribe to our channel and hit the like button. Here, we discuss what truly matters for your health. The kidneys are the silent workers of our body. Every day they filter about 180 liters of blood. They remove toxins, eliminate excess water, regulate electrolyte balance, and control blood pressure. But with age, their capabilities decline. By the age of 65, the natural rate of blood filtration drops by nearly 30%, according to specialists at the American Renal Health Journal. The main danger is that early kidney damage does not cause pain. No fever, no vivid warning signs. Only weakness, rising blood pressure, swelling in the legs, more frequent or less frequent urination. These symptoms are often dismissed as simple fatigue, aging, or heart problems. Meanwhile, every lost function of the nephron, the kidney's filtering unit, is irreversible. Another threat is chronic inflammation. Low-grade inflammation damages blood vessel walls, impairs kidney blood supply, and triggers fibrosis, when normal tissue is replaced with scar tissue. In this state, the kidneys lose their ability to properly filter blood. Kidney dysfunction sets off a cascade of problems. Toxin levels in the blood rise. Anemia worsens due to a lack of erythropoietin, a hormone produced by the kidneys. Heart function deteriorates, stroke risk increases, and osteoporosis develops due to disrupted calcium and phosphorus metabolism. Hidden factors pose particular danger. High blood pressure and diabetes are the two main enemies of the kidneys. According to the American Chronic Disease Center, more than 60% of all kidney failure cases are linked to these conditions. High blood pressure damages the tiny blood vessels in the kidney glomeruli, while excess sugar destroys their tissues at the cellular level. Many older adults are unaware that taking certain common medications is also dangerous for the kidneys. Prolonged use of non-steroidal anti-inflammatory drugs, such as ibuprofen, impairs kidney blood flow and may lead to chronic kidney failure. Some antibiotics, blood pressure medications not adjusted for kidney function, and pain relievers also have a negative impact. Insufficient water intake worsens the situation. As we age, the sense of thirst diminishes and the body experiences chronic dehydration. This increases toxin concentration in the blood, makes elimination harder, and strains the kidneys. In conditions of fluid deficiency, the risk of kidney stone formation rises several times over. Excessive salt intake also damages the kidneys. Salt retains water in the body, raises blood pressure, and amplifies inflammatory processes in kidney tissues. According to the Nutrition and Kidney Health Review, seniors with high sodium intake have a 40% higher risk of kidney failure compared to those who control salt consumption. To protect your kidneys after 60, it is crucial to act consciously and systematically. The first priority is maintaining optimal blood pressure. Ideal readings are around 120 over 80 millimeters of mercury. If blood pressure rises, it is important to consult a doctor to select therapy that is safe for the kidneys. It is very important to avoid self-medicating, as some antihypertensive medications, if used incorrectly, can further burden the kidneys. The second important step is blood sugar control. Even borderline glucose levels, typical of prediabetes, negatively affect kidney blood vessels. The diet should be low in simple carbohydrates, sugar, white flour, pastries, sweet beverages. It should be rich in vegetables, berries, nuts, whole grains, fish, and low-fat dairy products. Regular physical activity, even light exercise, also helps stabilize blood sugar and reduce kidney strain. The third measure is limiting salt intake. According to the National Renal Nutrition Group, the daily sodium intake for seniors should not exceed 1 teaspoon per day, including hidden salt in processed foods. To reduce salt in the diet, one should avoid canned foods, smoked meats, processed foods, sauces, and deli meats, using spices and herbs to enhance flavor without salt. The fourth rule is maintaining water balance. It is important to drink evenly throughout the day, even without feeling thirsty. Pure water should be the main source of fluids. Carbonated drinks, juices with added sugar, strong tea, and coffee should be limited. For people with heart conditions or swelling, fluid intake should be coordinated with a doctor. The fifth requirement is maintaining a healthy weight. Excess weight increases the risk of developing type 2 diabetes and hypertension, the main enemies of the kidneys. Losing even 5 to 7% of body weight significantly reduces the load on kidney vessels and improves blood filtration. This can be achieved through adjustments in diet and increased physical activity. The sixth rule is regular kidney function monitoring. Blood tests for creatinine, estimated glomerular filtration rate, eGFR, and urine analysis help detect early changes. After the age of 60, such examinations are recommended at least once a year, and more often if diabetes or hypertension is present. The seventh rule is quitting smoking. Nicotine damages blood vessels, impairs tissue blood supply, increases inflammation, and doubles the risk of chronic kidney disease. Quitting smoking at any age significantly improves the prognosis for kidney and overall health. Few people realize that lack of physical activity after 60 directly harms the kidneys. A sedentary lifestyle worsens blood flow not only in the heart and brain, but also in kidney tissues. Blood reaches the kidneys more slowly. Oxygen and nutrients are delivered less effectively, and the risk of ischemic damage to nephrons increases. Chronic oxygen deprivation leads to capillary destruction and accelerates kidney aging. According to the American Institute for Circulatory Health, regular moderate physical activity reduces the risk of kidney failure by almost 30%. Even simple walks outdoors for 20 to 30 minutes a day help activate circulation, saturate tissues with oxygen, and support metabolic processes in the kidneys. The longer you stay active, the higher your chances of preserving these vital organs. It is also important to be cautious with medications. All painkillers, antibiotics, and blood pressure drugs must be prescribed with consideration for kidney health. Uncontrolled use of non-steroidal anti-inflammatory drugs, especially in people with high blood pressure or diabetes, should be avoided. Proper nutrition also plays a crucial role in protecting the kidneys. There are foods that help maintain kidney health. Nutrition is key to supporting kidney health after the age of 60. It is important to choose foods that help reduce inflammation, stabilize blood sugar levels, strengthen blood vessels, and ease the workload on the kidneys. Let's take a closer look at the foods that should definitely appear on your table. The first food is cauliflower. This modest vegetable is highly underrated. Cauliflower is rich in vitamin C, vitamin K, fiber, and antioxidants that help neutralize free radicals that damage kidney tissues. At the same time, cauliflower is low in potassium, which is especially important for people with weakened kidney function. It can be steamed, baked with minimal oil, or added to warm vegetable salads. It is beneficial to combine cauliflower with greens such as parsley, dill, or basil to enhance its antioxidant effect. The ideal serving is about 1 cup per day. The second food is blueberries. Blueberries are true natural healers for the kidneys. They contain anthocyanins, powerful antioxidants that reduce inflammation in kidney vessels and protect them from oxidative stress. Regular blueberry consumption improves microcirculation and reduces the risk of capillary damage. It is best to eat fresh or frozen blueberries without added sugar. They can be added to plain yogurt, cereals, or eaten as a light snack. The daily portion should be about 50 to 70 grams. When buying frozen berries, check the ingredients. They should be free of added sugars and preservatives. The third food is red bell pepper. This bright vegetable not only decorates dishes, but is also a powerful source of vitamin C, which strengthens muscle memories, reduces inflammation, and promotes better iron absorption. An important element in preventing anemia, often accompanying kidney diseases. Red peppers are rich in antioxidants, flavonoids, and carotenoids, while being low in potassium. It is important to eat red peppers raw, in salads, snacks, or as a fresh side dish. Thermal processing destroys up to 50% of vitamin C, so raw consumption is preferable. The fourth food is garlic. Garlic is a natural antibiotic and a strong antiseptic. Its active compounds reduce inflammation, help regulate blood pressure, and protect kidney blood vessels from damage. Garlic stimulates nitric oxide production, which dilates blood vessels and improves circulation. It also lowers bad cholesterol levels, preventing atherosclerosis that impairs kidney tissue nutrition. For maximum benefit, garlic should be consumed raw and chopped, added to prepared dishes. Heat treatment partially reduces its medicinal properties. 1 to 2 cloves a day are sufficient. The fifth food is apples. Apples are a source of soluble fiber, pectin, which helps control blood sugar levels and lower cholesterol, thus reducing the strain on the kidneys. They also contain antioxidants that improve vessel health and prevent inflammation. It is best to eat fresh apples with the skin, as it holds the highest concentration of antioxidants. Preference should be given to green and red varieties with moderate sugar content. The recommended daily portion is 1 medium apple. It is better to avoid apple juices, especially packaged ones, as they contain high amounts of sugar and little nutritional value. The sixth food is fatty fish. Salmon, mackerel, and sardines are rich in omega-3 fatty acids, known for their powerful anti-inflammatory effects. Omega-3s help lower triglyceride levels, stabilize blood pressure, reduce inflammation in kidney tissues, and improve the overall condition of the vascular system. Regular consumption of fatty fish 2 to 3 times a week is associated with slower progression of chronic kidney disease, as noted in the American Kidney Nutrition Review. When preparing fish, it is important to avoid frying in oil. Baking, steaming, or grilling without added fats is preferable. The seventh food is olive oil. True cold-pressed olive oil is not only a source of healthy monounsaturated fats, but also a strong natural antioxidant. Olive oil helps reduce inflammatory markers in the body, protects blood vessels, and improves the lipid profile. Just 1 to 2 tablespoons of high-quality olive oil daily help maintain vessel elasticity and ease the workload on the kidneys. It is best used in salad dressings or added to ready meals. It is important to choose extra virgin olive oil and store it in a dark bottle, away from heat and light. Many older adults underestimate the danger of kidney problems, thinking that mild swelling or slightly elevated blood pressure is not serious. However, these subtle symptoms often signal the beginning of severe diseases. Progressive decline in kidney function leads to the body's inability to efficiently cleanse the blood. Toxins, excess fluid, and waste products accumulate. Chronic fatigue, headaches, memory problems, muscle weakness, and shortness of breath appear. Swelling in the legs and face becomes more pronounced, and blood pressure gets harder to control. A particular danger is chronic kidney disease, which develops silently over many years. According to the American Center for Kidney Health, 1 in 3 people over the age of 65 has hidden kidney function issues without knowing it. Lost nephrons cannot be restored. Once kidney tissue is replaced by scar tissue, there is no way back. The progression of the disease leads to severe kidney failure, requiring dialysis or a kidney transplant. Dialysis is not a cure, but a method to temporarily replace kidney function. It requires visiting a clinic several times a week and comes with many restrictions on diet, fluid intake, and physical activity. Kidney transplantation is a complex operation with risks of organ rejection and the need for lifelong immunosuppressive therapy. Additionally, elderly patients have a harder time qualifying for transplantation due to existing health conditions. What is especially alarming is that chronic kidney disease doubles the risk of premature death from cardiovascular complications. Even mild kidney function impairment doubles the risk of stroke, heart attack, and serious arrhythmias. This means kidney health is directly linked to lifespan and quality of life. Kidney dysfunction also leads to disruptions in mineral metabolism. Osteoporosis develops, bone fragility increases, and the risk of fractures rises. The kidneys play a critical role in synthesizing the active form of vitamin D necessary for calcium absorption. With impaired kidney function, bones lose their strength. Anemia also develops because the kidneys produce erythropoietin, a hormone that stimulates the production of red blood cells. Lack of red blood cells leads to constant weakness, shortness of breath even with minimal exertion, and decreased oxygen supply to the brain. It is essential to understand every small mistake in lifestyle after the age of 60 can cause irreversible damage to the kidneys. Smoking, dehydration, excessive salt intake, poor nutrition, uncontrolled blood pressure, and blood sugar. None of these go unnoticed. Conscious daily care for kidney health is vital. There are no small mistakes, only cumulative effects that eventually lead to disaster. Just a few years of neglect can cost a person their ability to live fully and independently. Therefore, it is especially important to remember these simple but life-saving rules. Monitor blood pressure and blood sugar levels, maintain a healthy weight, limit salt, sugar, and processed foods, drink enough clean water, include cauliflower, blueberries, red bell pepper, garlic, apples, fatty fish, and olive oil in your diet. Quit smoking, control medication intake, and have regular kidney function checkups. Another critically important point is physical activity. Movement improves blood circulation, reduces inflammation, and stabilizes blood pressure and blood sugar levels. Walking outdoors, light exercises, swimming, and yoga. All of these activities help maintain kidney health. It is important to choose the level of activity that suits you personally and exercise regularly. Attention should also be given to the quality of sleep. Nighttime rest is when the body recovers, regulates blood pressure, and normalizes kidney function. Chronic sleep deprivation increases the risk of developing hypertension and diabetes, and thus the risk of kidney damage. Stress must not be overlooked. Constant nervous tension raises stress hormone levels, increases inflammation throughout the body, and disrupts circulation. Relaxation techniques, breathing exercises, meditation, and walks in nature help lower stress levels and protect the kidneys. It is essential to remember health is the result of everyday choices. It does not come by itself. It requires attention, discipline, and care. Every glass of water, every refusal to overuse salt, every walk is a step toward protecting your kidneys and your life. Neglecting these simple truths can lead to irreversible consequences, gradually increasing fatigue, swelling, back pain, difficulty urinating, anemia, memory problems. All of these are signs that the kidneys are struggling. Without proper actions, a person can move from mild discomfort to complete dependency within a few short years. And the most terrifying outcome is the loss of control over your body, being unable to leave the house independently. The need for constant medical care, persistent weakness, apathy, fear. This is what the final stages of kidney failure look like, and this is the fate of those who fail to take timely action. If you have watched this video to the end, it means you truly care about your health. But information alone is not enough. To preserve vitality, independence, and a full life, actions are needed. Today, you have the chance to take the first step, to start changing while there is still time. Subscribe to our channel right now. It is not just a formality. It is your protection against mistakes that could cost you your health. It is your access to knowledge that can help you avoid disaster, keep your kidneys healthy, and stay free from illness. Click the like button under this video. By doing so, you will support the development of the channel and help other seniors discover these life-saving tips. Perhaps a single viewing of this video will become a turning point for someone, saving them from disability or serious illness. Write a comment. Share what steps you have already taken for your health, what challenges you are facing, and ask your questions. We read every message. Your experience matters not just to us, but to thousands of people searching for support and answers. Do not postpone taking care of yourself. Tomorrow may be too late. Your health is your most precious resource, and once lost, it cannot be recovered. Subscribe, click like, leave a comment, make the decision to act today, and take your first step toward a long, active, and happy life.